Northeast Tonight, brought to you by Pius Group of Institution, Guwahati.
Hello and welcome to Northeast Tonight, the show that decodes the region. First, the top of the day at this hour, the headlines. Total lockdown in Guwahati from tomorrow. People resort to panic buying. Traders allegedly sell essentials at exorbitant rates. Opposition Congress in Assam protests Sonowal government's move for a fresh lockdown. Is Manipur Chief Minister N. Biren Singh facing a fresh challenge? Reports of unhappiness brewing in BJP camp over NPP's return to coalition doing the rounds. Floods wreak havoc in Assam. Water levels of the Brahmaputra and tributaries continue to rise following heavy downpour. Thousands affected across the state. And Mizoram government relaxes lockdown in capital Aizawl and district headquarters. Odd even rules for vehicular movement enforced. Now to tonight's debate. From 7 p.m. tomorrow, Guwahati will be on a fresh lockdown for a period of 14 days. This move comes in the wake of 700 odd COVID cases of people without any travel history emerging in the city. Now the question arises, if there is community spread in Guwahati, the gateway to the northeast, can the rest of the region or the rest of Assam run the risk of facing a more challenging situation in the days ahead? How can this chain be broken so as to prevent a bigger community spread, not just in Assam, but in the entire region? To discuss the subject, I am joined from Shillong by Meghalaya Health Minister, Mr. A.L. Heck. Joining me also is Guwahati Police Commissioner, Mr. Munna Prasad Gupta. I also have Dr. Madhumita P. Das, Professor of Medicine at Guwahati Medical College. From Kohima, I am joined by Dr. Nyan Kikon, State Nodal Officer for COVID-19. In Dibrugarh, I have Dr. Rupali Barua, Professor and Head of the Department of Community Medicine at the Assam Medical College. And joining me from Imphal is Professor Debeswar Singh, Head of the Department Respiratory Medicine at the Jawaharlal Nehru Institute of Medical Sciences. Ladies and gentlemen, welcome to Northeast Tonight. Okay, we are on the verge of having a fresh lockdown that is from 7 in the evening tomorrow. Before we go to the other panelists, let's go straight to Mr. Munna Prasad Gupta, the Police Commissioner of Guwahati. A very busy man these days, extremely busy because there are 700 odd people, COVID-19 cases, people without any travel history. Until the decision to go ahead with the fresh lockdown, total lockdown in Guwahati from 7 in the evening tomorrow. There were a lot of places designated as containment zones. Mr. Munna Prasad Gupta, welcome to Northeast Tonight. Extremely hectic days. What is the new strategy? We are going to have a fresh lockdown in Guwahati, which you are planning to enforce very, very strictly from 7 in the evening tomorrow. Mr. Gupta.
Yeah, right. You have rightly said that due to the spread of COVID-19 in Guwahati, we are going in for lockdown from tomorrow 7 p.m. It is going to be a very, very strict lockdown. I request people's cooperation. During this lockdown, everything will be closed except hospitals and pharmacy. Even the grocery shops will remain closed. So my appeal to the people is that people should remain indoors and should step out only if there is a medical emergency.
All right. Now, you know, this is basically done, in the wake of 700 odd people without any travel history, testing positive for COVID-19. So, since Guwahati is the gateway to the northeastern region, Guwahati is the gateway to the rest of Assam, obviously you have a lot of challenges, you have a lot of more responsibility, isn't it?
Right, quite true. And Guwahati is the gateway to the rest of Assam and rest of Northeast. And during the recent past, large number of people arrived here, transited through this place by air, by train, by road. So now that we are entering into a lockdown phase, I'll take this opportunity to point out a few do's and don'ts during this lockdown period.
Yes.
People from outside Guwahati, if their movement into Guwahati will be strictly restricted, so they will not be able to enter into Guwahati. Only on 3 conditions people will be allowed to come into Guwahati. 1, if they have to catch a flight from Guwahati. 2, if they have to catch a train from Guwahati. And 3, if they have some medical emergency and they have to attend a hospital in Guwahati. That too on production of tickets, valid tickets or medical documents. So everything will be checked. So my appeal to the people of other northeastern states and the other districts of Assam is that they should not come into Guwahati during this lockdown period unless they are one in these 3 categories.
So now it is very clear, Mr. Gupta, that air services and train services will continue as usual. How can a person go to the airport? How can a person come back from the airport? Will there be taxis available? Can you elaborate a little bit?
Yes, ASTC will run some buses from designated places for travel to airport and the railway stations. In addition, people having a valid ticket, they can use their private vehicles also, but only to go to the airport and come back home, or to the railway station and come back home. So we will check their tickets. So if somebody is going to drop someone to the airport or railway station, they should also, for the return journey, they should also have a copy of the ticket with them, so that on way back, when they are stopped, they can show that they had gone to drop somebody.
Okay, that means nobody from Guwahati can go to any of the districts in Assam in their personal car, or nobody from any other district can come into Guwahati during this entire lockdown period?
Certainly not.
Okay. Mr. Gupta, since you are saying that everything will be monitored very strictly, now how many police personnel will be on the ground estimated? Do you have an estimate for this 14-day period? Because this is going to be a very strict enforcement of the lockdown.
Yes, the entire city police force plus the CPMF that we have at our disposal will be on duty round the clock in shifts. All senior officers will be on the streets supervising duties. So I'll say that during this lockdown period, we will be out on the streets with full strength. And this is only to save Guwahati from the spread of COVID-19.
Right. Now,
and I request the people also.
Right. Now you see, as we know
also
that
to cooperate with us.
Absolutely, you are requesting the people to cooperate with us. We are also requesting on behalf of the authorities, on behalf of the police and the health authorities to cooperate with the government in this critical hour. Now, Mr. Gupta, before I let you go, Mr. Gupta, since Guwahati, as we have said, is the gateway to the northeast, suppose people arriving by air and by train to go to Meghalaya, to go to Manipur and other places, they will be allowed to go, isn't it? They will not be detained in Guwahati.
No, certainly not. People who are coming by air or by train, they can go back to their homes. On the way, traffic people or police will check them. They should produce the tickets. So as I said earlier, coming into airport and going out of airport and the railway station is allowed on production of ticket. One more thing I would like to point out here is that only 10% of the bank branches are allowed to operate in addition to the ATMs. So the banks will announce which are the branches that those will operate, and only with skeleton bank staff they will operate. So we will allow the bank officials to attend their banks only on the production of a special pass issued by their concerned bank that they are supposed to work during the lockdown period. Merely on production of identity card we will not allow, since the banks are supposed to work only with skeletal strength.
Now suppose I want to go to the bank to withdraw cash or some other work I have in the bank. Can I use my personal card and go to that bank branch?
To the extent possible, I would appeal that if it is not a very urgent, please do your transaction from home, online transaction. But if it is a very urgent work in the bank which cannot be avoided, then perhaps you can go to the nearest ATM or nearest branch and attend to your work. But my request is that please do your banking activities from your home, because nowadays everything is online.
Right.
That will protect people also from exposure to COVID-19.
Absolutely. My final question to you, my last question to you, Mr. Gupta, you know, during the first phase of the lockdown, right from day one, the Assam police showed the way, because there are a lot of destitutes in Guwahati who depend on food being offered to them by individuals or by hotels and restaurants. That is how they survive. Dry ration will not do, because these people do not have homes. They do not have cooking arrangements. Now, from tomorrow, when you have the lockdown strictly, has the Assam police got in touch with some of the NGOs to feed these destitutes? Or if not, are you going to make some arrangements today and tomorrow?
Yes, we are sensitive to the needs of weaker sections of society, and during lockdown period, as you have rightly said, some people may require help. So we will reach out. We will try and do maximum that can be done with the help of NGOs and philanthropic people. And district administration also will help them out in terms of distribution of ration, etc., as per government rules.
Absolutely, Mr. MP Gupta, thank you very much indeed for speaking to me despite your busy schedule, and we'd expect you to be coming on the program even in the coming days so that people can hear directly from you, and all their confusion and doubts should be removed. If they hear from a person like you, it becomes all the more easier for the common people. Thank you very much, Mr. Gupta, for speaking to me. Let me go straight now to begin the debate. I will quickly go to Mr. A.L. Hek, the Health Minister of Meghalaya, a very senior political leader. Mr. Hek, you have been vigorously battling, COVID in Meghalaya, but now Guwahati, the gateway to Northeast, has become hit by almost a community spread, as about 700 cases, as you have been saying, of people without any travel history has emerged. So how is Meghalaya preparing itself to deal with the situation, because Guwahati is so close to your state? Mr. Hek.
In our daily review meeting, which is chaired by the Honorable Deputy Chief Minister, we have taken a stance. Since we have not, opening the interstates to in Meghalaya is not, interstate is not allowed. Okay, for our preparedness is we have already told to the appeal to our people to avoid as much as possible going to Assam. So we will not allow people coming from the Assam for time being, except only on the medical emergency.
So So you are monitoring the situation very, very closely and are taking adequate measures. That's what you were saying, Mr. Heck.
Any time, any moment, we never sit idle, but we are taking a lot of efforts and initiative to ensure the Meghalaya is free from COVID.
Absolutely, Mr. Heck, I'm coming back to you. Before coming to the panelists from Assam, let me quickly go to Imphal, to Professor Debasar Singh, Head of the Department, Respiratory Medicine at the Jawaharlal Nehru Institute of Medical Sciences in Imphal. Viewers, as you know, after Assam, it is Manipur that has the largest number of COVID cases. It is more than 1,000 now. Professor Debasar Singh, now, most of the cases, all of the cases are actually people coming home, returning home and already in quarantine facilities. But are you preparing yourself for a possible community spread? And are you worried about the situation, what is emerging in Guwahati? Professor Singh.
Yes, of course. Good evening, first of all. And by what is happening in Guwahati right now, we are worried. But our state government is prepared, because from the very beginning, the government is arranging to screen all those who are coming from outside Manipur. And as such, from whoever is coming from outside Manipur, so far we had 175 till yesterday positive, and yes, and actually we had some difficulties at the very beginning regarding the positive cases which are turned out higher to keep. And right now, the government has activated the COVID care centers at the various districts of Imphal and Manipur. And of course, right now our medical college, there are 2 medical colleges, they are catering to these all types of these COVID-19 cases.
So,
and
are there
recently it has been decided that
carry on. Recently, what has been decided? Sorry.
Recently, we have it has been decided that more serious cases and symptomatic cases will be kept in the medical college hospitals, and the asymptomatic and very mild cases will be managed at the community level at the COVID care centers. So the burden will be reduced definitely, and
are you? Is there a trend? Are you increasing the testing? Are you increasing the testing facilities in Manipur? Is there any case of people testing positive without travel history? Professor Singh.
Right now we don't have, because almost all of them are from those who are coming from outside, except for 1 or 2, 3 cases of transmitting to the healthcare personnel and 1 volunteer. That is hardly 4 or 5 cases, and they are asymptomatic and improving, and many of them have turned out to be negative and will be discharged.
All right. I'll come back to you. Let me go to Kohima, where I'm joined by Dr. Nyan Kikon, State Nodal Officer for COVID. Dr. Kikon, once again, welcome to Notice tonight. Now we know that Nagaland also has people returning home. A lot of people, several of them have tested positive. But, is there any case of people without travel history testing positive so far? And what are you doing to prevent a community spread? Let's focus on your measures to prevent community spread. Okay.
Yes, we have been closely monitoring what's been happening in Assam, and as per the tweets of the Honorable Minister,
Please carry on. Carry on. I can hear you.
Health Minister of the Honorable Health Minister of Assam, we are Yes, yes. We are, yes. We are closely monitoring the situation in Assam. At the moment, all the positive cases that we have found in, we have detected in Nagaland is from the returnees. But then again, we have a few cases which we have detected who have no history of returning from the other parts of the country, but they have history of contact with the people who have come to Nagaland. So at this stage, it's in the stage of local transmission in some districts.
Okay. Okay. So there are few cases, but it is very clear what you are saying, Dr. Kikon, that even though they had no travel history, but it is clear that they have come in contact with people who had come from outside. So you know the source actually, you know, there is no community spread as such, but these people have come in contact with the COVID patients. I'll come back to you. Let me go to Dibrugarh. Dr. Rupali Barua, yes. How are you observing the situation in Guwahati? 700 people without yes. travel history, okay. You know, suddenly testing positive for COVID. Do you think this is a case of community spread? What are the measures that should be taken to break the chain?
Wasbir, this is a very alarming situation. From Dibrugarh, I'm observing what is going on in Guwahati. And we at present are having more than, I think, 207 containment zones. This was inevitable. And the government declaring a lockdown for another 14 days is a very welcome move. I think this, we should all accept and welcome this move, because this is one way of preventing the community transmission. Because situation is really very, very alarming. And from history, if we go back and look to the mother of all pandemics, the Spanish flu pandemic, which occurred 100 years back, similar things are happening, and I think we should learn from history. The second wave was the hardest, where the maximum casualties occurred. And if you remember, or people read history, that pandemic, we had lost almost more than 1/3 of the global population. 50 million or more perished in that pandemic. That was in 1918. Same thing, exactly the same thing is repeating. And so these are the lessons we have to learn from history, and we should not make the mistakes again. We cannot lose so many lives.
Right, right.
And so 700 persons testing positive without travel history is something very alarming, and we have to prevent the community transmission of the disease.
Okay, I'll come back.
Opinion, Wasbir.
I'll come back to you, Dr. Rupali. I'm coming to you, Dr. Madhumita P. Das. Dr. Madhumita, you know, you've heard Dr. Rupali there supporting the lockdown, say that it's a welcome move and so on. But there is another school of thought, which says that according to this view, that when you do a lockdown, when you carry out a lockdown, a lot of people are forced to stay indoors. You know, indoors, what you have people with comorbidity who do not usually go out. You have old geriatric people who are usually stays at home, old people, they don't go out. But when you have a lockdown, even the younger people who are exposed to people, they come in, they have been moving around all these days. Then the lockdown will force them to stay. And many of the houses are not very big enough. You know, so a lot of people will be forced to stay indoors because of a lockdown. So, lot of the second argument is that lockdown is not a very good option in such kind of a situation. What do you think is the right move?
Thank you, Wasbir, for giving me this question, for asking me this question, because I had already mentioned, we just discussed about it. Lockdown has got its own pros and cons. The basic idea of a lockdown is to achieve social distancing. You have to see that people have been able to prevent transmission from one person to the other. That's the basic thing of a lockdown. But such a strict lockdown as the government has decided, I think downstream there are a lot of other things happening. As you've just mentioned, yes, there'll be clustering of the young people who are actually going out to work otherwise till today. it will be a Dharavi-like situation, maybe, where all these people will go back home, they'll stay with their elderly parents, their pregnant wives, their other relatives with comorbidities, their young children. So there could be a possibility that the cases that will that will come out at the end of this lockdown may be very severe. They may be so bad that till now we do not have any COVID patient in the ICU. We do not have any COVID patient requiring very high level of treatment or even plasma exchange or things like that. They have been mostly recovering. The patients whom we have lost are the ones who had comorbidities. They have died out of other diseases. They have not succumbed to COVID as such. But there is something to worry that at the end of this lockdown, if the vulnerable section come out COVID positive, then the whole scenario of the disease pattern will change and we might be headed for something disastrous.
So what you are essentially saying, Dr. Madhumita, is that, we have to take care of the aged. We have to make sure that people with comorbidity are protected, and therefore, I think this is this could pose to be a more challenging situation. I'll come back to you and expand on this.
Just a small bottom line, that social distancing maintenance is very important, and that has to be implemented in every household.
So, the basic purpose which this lockdown is supposed to achieve is social distancing, but if the people adhere to the rules and regulations, that means even without a lockdown this can be achieved. And the other day, the Additional Director of Police, Additional Director General of Police, Mr. Harmeet Singh was telling on this show, he had said on this show that 4.5 crore rupees was collected as fines in the last 3.5 months in Assam, 58 lakh for not wearing mask. That means the people are violating or flouting some of the rules and forcing the government to impose the lockdown once again. Whether it is the right move or not is debatable, as there are two views that has clearly emerged. Mr. A.L. Heck, I have to let you go. Is there any case of people without travel history testing COVID positive in Meghalaya? Mr. Heck.
This is, of course, this is not a community spread. So we have 1-2 cases like that. We have been tracking all the history, travels and all, but whenever we going for the tracing contact, we all found negative. So that is only individual, is not, this is coming from Assam only. Tested 1 positive, that is from the Riboy district. This person also, he been stayed there, he is the mailman, staying there in the Guwahati for 2 months.
Right.
He came to Shillong on the 24th of June. We did the testing on the same day. Then after we found positive, we have sent him to the Corona Care Center. So that tracing contract also we have been doing.
Okay. Mr. Heck, I'd request you for some more time before I go for a break very quickly. Professor Debasar Singh, Manipur, the Imphal Valley is also a very crowded place. Imphal is a very thickly populated city, and what are some of the recommendations, your personal recommendations to prevent a community spread in Imphal?
Yeah, right. Yes, the most important thing is the people should maintain this social distancing at least 1 meters. Then wear masks covering the face and the nose, and the hand hygiene, and avoid touching nose and mouth. And but I have seen many people not following this kind of this wearing masks and hand hygiene, social distancing, etc. That's why the government has been worried, and they are doing the lockdown process.
Okay.
And of course, by seeing this problem, we are quarantining, doing institutional quarantine for whoever is returning from outside, and they are getting tested. These are the foolproof methods to control the community spread.
Okay. And very quickly, Professor.
So far, they have been successful.
Right. Very quickly, Professor, are you in favor of a lockdown? Is lockdown a good strategy?
Yes. Because the lockdown cannot be done for long, it cannot be permanent. And during the lockdown period, our government should strengthen the resources and build more or construct more or prepare more COVID care centers in the periphery and improve the quarantine facilities and of course the facilities available at the various healthcare centers, including the peripheral centers.
Okay.
And the lockdown has to be not complete because the many persons who are working and earning by manual laborers and all those, and in small-scale industries, this
Absolutely.
And again, of course, the
Absolutely. You are
women
very
vendors,
true.
selling vegetable and all.
Very true.
For them, yes.
Very true. Very true.
And,
Lockdown
if,
impacts on...
If they are not given the people, yes.
Yeah, lockdown impacts on small traders and the disadvantaged sections of society. I'll go for a short break. Don't go away. On the other side, I'm likely to be joined by the Principal Secretary Health in the Government of Assam, Mr. Samir Sinha, and of course I'll go to Kohima to understand as to how they are battling the COVID in the state of Nagaland. Don't go away. I'll be right back. Welcome back. I'm now joined by Mr. Samir Sinha, the Principal Secretary Health, Government of Assam. Another terribly busy person. Mr. Samir Sinha, welcome. You are live on the phone. You know, after this 700 cases have emerged of people without any travel history, we are seeing this fresh lockdown from 7 in the evening tomorrow for 14 days. Now, how different is the situation? Is the challenge, has the challenge increased for the health authorities? Do you have adequate infrastructure? What about the new COVID hospital that is coming up at the veterinary grounds in Guwahati? Can you elaborate a little bit, please?
Yes, hi Wasbir.
Hi.
Sorry, I could not join. I would like to. Do I have some 1 minute time to explain?
Yes, please, go ahead.
What was happening was that with the establishment of new testing facilities, you are aware that we are testing a very, very high number in Assam today, and in terms of per million, in fact, tests per million also, Assam is among the top few states now. So then we started targeting different segments where a special emphasis were given, like truck parking areas and maybe petrol pumps, market areas, warehouses, godown, etc. Simultaneously, what we did was that we opened 10 new collection centers in Guwahati, and where people came in, and in fact they can come and give their sample, and then we started getting all these startling numbers, the numbers that you are talking about, 700 plus, it could be 800 plus, and these were the cases were coming from the community. So then this was a kind of a very, very big challenge, and subsequently, you know, that the lockdown. As far as coming to the question that you have posed, we already, in fact, we started with 2 centers, primarily with Guwahati Medical College at the top, and with all medical colleges in the respective geographies.
Yeah.
And then MMCH, Mahenman Chaudhary and Sonapur district hospitals. These were the 2 hospitals where we primarily, in fact, we housed our people. Then we added, in fact, we started building our capacity. In fact, not only here in Guwahati, but in all the other places also. Then we started from the medical colleges, we started going down to the district hospitals, and it takes a whole lot of effort because the thing about COVID is that it is evolving, and about the medical protocol, about the clinical protocol, about the need to kind of wear all the protective gears. Everything you have to provide training to the team, right from the doctors to the cleaners. So here we added a few facilities in the last fortnight. I would like to inform everybody, all the viewers, that we added Kalapahar Hospital, then we added Kalitakuchi, Singimari, then also the government Ayurvedic hospital, which was kind of we prepared all under the, in fact, as our health minister has been planning quite far, in fact, ahead from all of us. And now, maybe within a couple of days, we would like to add 2 more facilities, one big size, which is right in the heart of Guwahati. This is in the veterinary field. We will add another very big facility of around between 700 to 800 capacity COVID care center. And today we decided to convert another important building into COVID care center. In fact, Honorable Health Minister was also there. I was also there in Palasbari, where the Patanjali center is there. So we would like to take, because that will give us another elbow of around 250 beds. Please
Mr. Samisina, that means if we say that Guwahati, that means what will be the number of beds, available? I'm not talking about quarantining. I'm talking about positive patients. What will be the total number of beds? If you look at these new facilities, 700 beds in the new veterinary college, and so on and so forth.
Right. If you see the number of beds, in fact, Guwahati Medical College has got around 200 beds. MMCH has got 123 beds. Government Ayurvedic College between 100 to 110 beds. District Hospital Sonapur has around 100 beds, 103 to be precise. Kalapahar Hospital, which we put up, 126 beds we have there. And in Singimari, 80 beds, and in Kalitakuchi, 52. This takes the total to around 790 or so. So with this veterinary field COVID center, we'll add another 800, and in this Palasbari, this Patanjali hospital will give us another 250. So the total bed would be around say 2,000 in Guwahati city as of now. But obviously we are planning about many centers, and we are actually on the job. And this evening also, the Honorable Health Minister, he reviewed the entire situation about accommodation and further planning on running hospital. What's very, very important is, Wasbir, is not the building. We have to kind of sanitize and put all kinds of consumables, all kinds of training, the team building, because you are aware that right from doctors to everybody needs to be quarantined after 7 days of duties. And every day we will have to have kind of 4 teams. 3 teams for regular duties and 1 team in reserve. So this is a kind of a very, very, in fact, when we talk about, the teams would constitute from doctors to nurses to ward boys to lab techs to pharmacists to cleaners to data entry operators to superintendent in charge to matron. You have to, all of a sudden, in fact, our HR is limited, human resource is limited, but we are, in fact, this is a very fortunate thing in Assam that everybody is coming forward and supporting us in this endeavor.
Absolutely.
In fact, within 2 days, we've been able to put up Kalapahar hospital as the COVID care center.
Okay.
Same is the case with Singimari and Kalitakuchi. Today, when I went to Palasbari, for the first time we were there, and in fact, we'll be able to put up that DC Kamrup rural was also there. We are hopeful that by day after tomorrow morning, 9 o'clock, we'll start taking patients at.
Okay, that is quite reassuring to hear this, Mr. Samit Sinha. But at the end of the day, we have to break the chain of community spread in Guwahati. That is the biggest challenge, for which the lockdown is starting for tomorrow. A lot of people are also criticizing the lockdown, but perhaps we don't have very many options.
The issue here is, in fact, if you see the number of cases which came up every day, in fact, the number of cases were increasing. And in fact, primarily, Wasbir, we were getting, in fact, earlier, almost 100% positive cases would emanate from our quarantine centers and hardly from the community. But gradually, it became 70-30, then it became 60-40, 50-50. And today, in fact, we are getting 90% of the cases, positive cases, are coming from the community. So this is a very, very
something alarming. That is something alarming.
Very, very alarming. And the positive side of kind of lockdown is that it helps in breaking the chain, which is very, very important.
Absolutely.
Yes.
Absolutely.
So this is kind of,
right.
Yeah.
Right.
So,
Mr. Samit Sinha, thank you very much for updating. These are very, very critical inputs that you have given. Thank you very much for speaking to me on Northeast Tonight. I'd like to, really sorry to keep all the panelists waiting. That was the Principal Secretary Health giving some critical inputs. Now, Mr. Nyan Kikon, you have heard the Assam Principal Secretary. Mr. Kikon, can you hear me? Mr. Kikon?
Yes.
Okay.
Online.
Yeah. Now today, 90% of the positive cases every day in the last few days are from...
yes, I just got back. Just got connected. Yes.
Yeah. Now, 90% of the cases in Guwahati are from the community, not from the quarantine centers. So now, since Guwahati is the gateway, I think the other states also cannot sit tight. You have to prepare yourself, Mr. Kikon. Okay, there is
Exactly. Yes, so in this matter, at this present moment, we have all the cases, most of the cases that we have are, yes. Hello?
There is a serious network problem. I will come back to you a little later. I will request the producers to fix the line, disconnect and fix the line with Mr. Kikon. Professor Devasya Singh, the same question goes to you. You have to take extraordinary measures now. Do you think the infrastructure needs to be increased so that if there is a case like that, if the situation becomes difficult, you have to tackle? So more facilities are necessary, isn't it? More beds are necessary.
Yes.
In Manipur. So how are you preparing?
Yes, of course. Yes, the government has already anticipated this kind of things coming up. So they have improved the quarantine facilities, they have improved the testing capabilities, and of course some private laboratories have been given authorization with accreditation process to conduct the tests, etc. And of course the COVID care centers have been increased. And hopefully our government is prepared. But definitely the level of things happening is not that 100% comfortable. But there is no comfort actually in this kind of situation.
There is no comfort in this kind of situation. Mr. Heck, how are you utilizing the community leaders, the church organizations and the traditional institutions in Meghalaya? I'm coming to you, Dr. Rupali Barua. Mr. Heck, how are you utilizing the community leaders, the church, the traditional institutions?
First of all, before I give my information to you, I'd like to thank the community volunteers. So we have the Darbar Shnong system, the traditional institutions. Okay, we have the traditional institutions,
right.
That is the Darbar Shnong.
Yes.
These people, they have a very, very strong COVID-19 committee. They have been taken care by all the Darbar Shnong and also the NGOs and also the Seng Samla and also the Seng Kanthay, means the Mahila group. They are very, very, they have taken so much pain and interest to ensure this community spread will not be there.
Right. Now, Mr. Heck, that means you are utilizing the NGOs and the community leaders fully.
Not fully, we are engaging them, but they are voluntarily coming forward to help the government. They are coming forward by themselves. And they are taking the responsibility by themselves to help the government. We are not engaging them, but we are together working, both the community and also the government together.
And how is the lockdown proceeding? What is the status of the lockdown in Meghalaya?
See this now for the state of Meghalaya, we have already told you also. I just reiterated what I had told you, that already we had taken the review meeting. We'll try to as much as possible to maximum level. Will not allow the people to entering into our states, and also we appeal to the people from our state also not to travel to Assam for time being.
Okay. My final question to you, I'll let you go now. Mr. Heck, are you hopeful your strategy is okay and you will continue with this strategy?
Of course, we will continue with this strategy and will be more enhanced, the facility and also, whatever facility we can be enhanced more to protect the COVID-19 to the state of Meghalaya as much as possible.
Absolutely. Mr. Heck, thank you very much for being on the program. Let me once again go to Mr. Nyan Kikon. He is connected now. Mr. Nyan Kikon, if you can hear me. My question was, you are dealing with the situation now steadily. People are coming. Maybe the number of people coming has gone down. But how are you preparing yourself?
Yes, I can.
Are you increasing infrastructure in the meantime? Are you increasing the number of beds? Are you converting certain other places into COVID hospitals?
Yes, this is an evolving situation, and the matter and situation is being studied and carefully considered for future course of actions. Many COVID centers have been activated in many districts. So, yes.
Okay.
So, as per the evolving situation, matters are being discussed at the highest level. There is participation from all agencies of the government, including even the civil societies, the faith-based organizations, and also the village level communities. So there's an involvement from all sections of the society to have this fight against COVID-19. But I would also like to add one thing, is that Nagaland, we are 3 months behind the rest of the country. So whatever has been happening in the rest of the country, they have evolved to a level of a certain level where our state has not yet reached. So we are also taking that matter into consideration and also having a very considered view of all the developments which have been happening in many states, especially in all the metros where some sense of...
Right.
Yes.
Right. Hold your thoughts, Nyan. Hold your thoughts, Nyan. I'm coming back to you. Dr. Rupali Barua, how important it is, to reach out to the community. You are the head of the Department of Community Medicine, but usually
Right.
medical professionals, trained doctors, I'm talking about doctors usually we find very few doctors actually working with the community. Going out of the hospitals, working with the community, making awareness. Yes, paramedical staff, paramedics go, but not doctors usually. Am I correct?
No, I don't agree with you, Wasbir. We are the only department in the medical college, in fact, in all community medicine, in all the 7 medical colleges. We are reaching out to the community, and right from the start, of the pandemic, we have been going to the community and generating awareness, not only through TV, radio, but we are personally going house to house and, generating awareness, because, 70% of our population live in the rural areas. We have to reach out to them. And we doctors, not only paramedics, we doctors are going. And from Assam Medical College, we are covering 5 districts: Dhemaji, Lakhimpur, Soraido, Tinsukia, Dibrugarh district. And we are going door to door and covering all the people and to generate awareness, because that is very important. Because in urban areas, people understand and they follow the rules of social distancing, not always, of course, wearing the mask, But creating the awareness in the community, that is very important to break the chain of transmission, and that our department is doing right from the start of the pandemic.
All right. All right. That is what
I
the
think,
community
very
medicine...
visible. If you go out and reach out in the community, you will see that our doctors are working in the villages, in the sub-centers, in the primary health centers, not only through the paramedics. We doctors, senior doctors, we are visiting.
Absolutely.
Giving trainings to all the staff, to the people, through the NGOs, to the ladies club, to the youth clubs, and we are reaching out to the community. We work silently. We are not blowing our trumpets, so maybe we are not very visible. But we have, from my department, we have done a series of radio talks. And interestingly, people from, say, my driver's wife calls up, "Ma'am, I heard you regarding talking on COVID."
All right. My question was not
in the villages.
No, I was asking a general question. Hold on. I was asking a general question. My question was not directed at Assam Medical College or so on. My question was general. Now, Dr. Madhumita, you know, until a vaccine comes, until a proper medicines emerge for treatment of this COVID-19, I think we are going to have, do you think we are going to have this kind of a phase? Lockdown, ease the lockdown, strengthen the lockdown, you know, unlocking the lockdown. Is this going to be a way of life for the next couple of months at least?
Yeah, I don't really believe in that, because at this moment, yes, as we've just heard, that more than 90% of the cases reported in the last 2-3 days has been from the community. So we are at a point in the pandemic where we have no choice but to go for a lockdown. But lockdown is no solution. A permanent solution, we have to live with COVID. We are all aware of that. The permanent solution will be to inculcate the sense of responsibility amongst every citizen in this country or in this state, that I myself am responsible for the prevention of COVID in me, in my family. I have to wear a mask. I have to maintain the social distancing. I have to keep washing my hands. That is something we've been hammering on for a very long time.
Right.
But it's very unfortunate that there has been a lot of people on the road who are blissfully unaware, and they think that they are never going to be affected with COVID. And that is the reason why we have reached at this stage of the pandemic. God forbid, if we can really try and come out of this stage, we can and can spread the message of prevention. I'm sure even if we have to live with COVID for a couple of years from now, we can.
Dr. Madhumita, what is the lesson learned? You see, we have so many medical colleges in the country. Take the case of Assam, we have so many medical colleges, but we are on a day-to-day dealing with ailments. Now, the problem is, we don't give much of an emphasis on research and development. Now, okay, there are other institutions to do research and development, but don't you think, Dr. Madhumita, that time has come in our country that every medical college should have a specialized center engaged in research and development only, exclusively, with full aid and support from the government?
Yeah, that's very true. And the fact that you said that in our country there isn't enough of research and development, that's also not true. Because there are the premier institutes like the All India Institutes, JIPMER, the SGPGI, I mean the big institutes, the CMC Vellore, where they are doing, I mean, really world-class research. They have the funding, they have the brains, they have put in the best possible effort, and they have done it. Unfortunately, in our part of the country, yes, we are lagging behind in that. Though we are trying, we have a lot of problems and limitations for which maybe we have not been able to go far ahead in the front line of research, but we do try at our level, but rest of India, there is a lot happening.
Absolutely.
And don't be surprised if India comes with the first vaccine against COVID.
Absolutely. Let's all hope that India comes with the first anti-COVID vaccine. Professor Debasar, final comments to you, 20 seconds. Don't you think our focus now should be on research and development, entire medical community, whether it is in Imphal, whether it is in Guwahati, whether it is in Delhi, Bombay, do you think the focus should be on research and development?
Yes, of course, there should be emphasize a point on this. And And of course, the investment, or what should I say, the expenditure in the healthcare system should be improved. And the COVID-19 has definitely put us on the test, and we have realized that we have not put enough money on the healthcare facilities. This is the
absolutely the focus should be on research. We might have to live with COVID for a long time, longer than perhaps every one of us is expecting, until of course a vaccine emerges on the scene, or for that matter medicine. But at the end of the day, I think we have to delay the spread of the disease until the vaccine comes, and perhaps therefore lockdown is one of the immediate measures that we have adopted, but that of course is not a solution. I thank all my panelists for participating in this very engaging discussion, and for some of the panelists clarifying matters for the benefit of the viewers and the people in general. That has been very, very helpful. On that note, I end this edition of Notice tonight. I thank all my panelists and the viewers for watching the program. Good night and goodbye.
Northeast Tonight, brought to you by Fuse Group of Institution, Guwahati.